Hello. If you are watching this, chances are your pet has just had oral surgery at Hale Veterinary Clinic, and I will be sending you a full report. It will come as a PDF file attached to an email. This report will have several pages, the first of which will be a cover letter, in which I will briefly describe what I found today, what I did about it, and what our plans for the future are. This report will also likely include several links to papers on my website that will discuss your pet's particular problems in greater detail. The second page of the report will be a dental chart, a blank version of which you see here. At the top of the page will be typed information about you and your pet. In the middle of the page, we see several rows of teeth. The top 3 rows are depicting the teeth of the upper jaw, as seen from 3 different views. The top row of those 3 is as if we're standing outside of the mouth looking in at the outside surface of the teeth. The next row is as if we're standing inside the mouth looking down the crown of the tooth from the tip of the tooth towards the gum line. And the third row is as if we were standing on the tongue looking at the inside surface of the teeth, the palatal aspect of the teeth. Then there's a horizontal line through the page, and below that we see 3 rows of teeth, and those represent the lower teeth, the teeth of the lower jaw. Again, as seen from standing outside of the mouth looking in, as standing inside and looking down onto the crown of the tooth, and as standing on the tongue looking at the tongue side of the teeth. Above and below the rows of teeth are the grids containing the box scores, numbers that I use to evaluate the periodontal health of each tooth. The top row in each grid is for gingival recession, and that's recorded in millimeters. And then the others are all recorded as scores from 0 to 3 or 0 to 4. In all instances, we want to see zeros in those boxes. The higher the number, the more diseased the tooth. To simplify record keeping and communication, each tooth is assigned a 3-digit number. Below the box score of the upper teeth and above the box score of the lower teeth, you'll see those 3-digit numbers assigned to each of the teeth. And those are important when we get to the discharge statement, and also those numbers are used in the cover letter. The third page of the report will be the discharge statement, a blank version of which we see here. The copy you receive will include the information specific to your pet's treatment today. In the first box, I'll list all my clinical and radiographic findings and my interpretation of them, and I'll be using those 3-digit numbers we discussed earlier. The next box down outlines what I did about all of those findings, so listing the specific treatments carried out today. In the prognosis section, I will indicate what we might expect in the short term, and there may be a comment on what to expect in the longer term as well. The next 3 blocks all relate to pain management, and depending on what we did in your pet's mouth today, some or all of those blocks may have been deleted. The first indicates whether or not we used local anesthetic, and if so, what recipe was used. The next line indicates whether or not a postoperative injection of meloxicam was given, and if so, at what dose. And then the third section indicates what drugs have been dispensed for you to give at home. You'll also be sent links with specific instructions on the very particular medications we sent home for your animal, when to give them, and how to give them. The next line on the template is to indicate whether or not I used an antiseptic rinse in your pet's mouth today. I frequently don't, so chances are that line will have been deleted from your report. Now we come to the feeding instructions. If what we did today resulted in no wounds that require healing, your discharge statement will just say normal, and then suggest that you can offer a small meal as soon as you get home. And if that is eaten and your animal keeps it down, they can have another small meal an hour or so later. We usually want that first meal post-operatively after an anesthetic to be just about a quarter of what they would normally eat. If we've created wounds and your animal's going to require healing post-operatively, we'll send you a link with more specific instructions on what and how to feed. If your pet has wounds in its mouth that require healing, under the feeding instructions, there'll be a line indicating that you should withhold hard toys, treats, or biscuits for 14 days because we don't want your pet biting down on the wounds and breaking them open. Next is a line related to rechecks, which typically indicates that you should return to your primary care veterinarian in about 14 days so that they can assess healing. If you live close to Hale Veterinary Clinic, we'd be happy to do that follow-up for you at our facility. There may also be an indication of when the next dental procedure would be due. Below that, under the special comments and instructions section, If we've dispensed home plaque control products, that will be indicated in that area. And if we've sent your pet home wearing an Elizabethan collar to prevent them from pawing or rubbing at their faces, that will be noted in this section of the discharge statement. We'll also have a link for a video specifically about Elizabethan collars. For dogs going home with teeth still in their mouths, the next section of the discharge statement will include a discussion on hard toys to be avoided. We mentioned specifically to never give dogs natural bones, nylon bones, antlers, large rawhide bones, dried cow hooves, or ice cubes. We could add to that list dried bull penises, rocks, basically anything that you or they would not want me to hit them in the kneecap with should not be chewed upon. And that's referred to as the kneecap rule. And there's a link on the chart that takes you to a paper discussing that in some greater detail. It does suggest that you can provide Kongs or greenies, if used appropriately, that those would be safer. There are certainly other brands of rubber toys, and there are other treats that a dog might enjoy that would be similar to greenies, but I mention them specifically because they have the Veterinary Oral Health Council seal of acceptance. And next we have an instruction to keep your pet's activity level reduced for a few days. For dogs, it's okay for them to go for a walk on leash, but I don't want them off leash chasing squirrels and getting wound up. And for both dogs and cats, I don't want them charging around the house, chasing their housemates, chewing on them and wrestling and so forth. Basically, I don't want them doing anything that would get their heart rate and blood pressure up, as that could lead to more swelling and discomfort. And I also don't want them using their mouths in ways that might disrupt the healing. If I'm particularly concerned that your dog or cat may exhibit post-operative swelling, I'll have a different link for you about that. Next is a very important instruction that you not handle your pet's mouth at all for 14 days. I don't want you trying to look in the mouth. I don't want you trying to force food or medications into your pet's mouth. I don't want you doing anything that could put pressure or tension on the stitches and disrupt the healing of the wounds or cause your animal pain. The next section on the template refers to home plaque control. Depending on the specifics of your pet situation, that area may have been deleted. For instance, if it's a cat who's had whole mouth extraction, no longer has any teeth to be brushed, we don't have to worry about that. But this section will be edited for the specific home care needs of your pet. Next is a comment that following oral surgery, there may be some bloody oral discharge for a day or so. The wounds have been sutured closed, but they may ooze. Also, if your pet's surgery involved the upper jaw, we'll sometimes find that the disease process is extended through the bone into the nasal passage. And so if we're concerned about that, your statement may also indicate that there may be some bloody nasal discharge for a day or so. The next statement indicates that being anesthetized is tiring, so your pet may be quieter than usual for the rest of the day and overnight. This isn't always the case. Some animals are very high drive, very energetic, and they go home as if nothing has happened. Others wake up and are quite lively and anxious to get home, and then when they do return home and they're in their own environment, feel more relaxed, they kind of crash for the rest of the day. And finally, there's a statement that if you have any questions or concerns at all, by all means get in touch with us. We'd much rather you call with a question that didn't need to be asked than not call with a question that did need to be asked. The remainder of the report consists of preoperative clinical photographs and radiographs, and postoperative images as well, with the more interesting findings highlighted and labeled. All of this is to aid your primary care veterinarian and you in understanding what it was I found and why I did what I did about it. Photographs and radiographs can be very helpful in enhancing one's understanding of these complex situations. Some of the images are a bit graphic, so viewer discretion is advised. Thank you very much for trusting us with the care of your pet.